Kaitlyn received an ELF loan from Chapter G in 2020. She grew up in Chesterland, Ohio, received her Bachelor of Arts degree in biology at Worcester College in 2018, and is currently getting her Doctor of Physical Therapy degree at the University of Pittsburgh, which she is graduating this December with. Kaitlyn is especially interested in working with veterans, which is the largest population of people who need prosthetics and orthotics. She has an added interest in working with people with spinal cord injuries and in adaptive sports. She especially enjoys the process of coaching and encouraging veterans as they learn to use and be comfortable with their prosthetic. This also requires that she show a lot of empathy toward her patients. And she proudly says that she got that gift of empathy from her dad. So I'll let you tell the rest, Kaitlyn, and you can just take it away. Thank you.
Sure. Thank you, Lisa. So like she said, my name is Kaitlyn. I am going to be graduating in, I think, let's see, December 12th. So it's coming up pretty fast and pretty soon. I think in just a few weeks here. So since then, most recently, I've been working full-time in a clinical rotation. So I've been working in a combined outpatient neurological and orthopedic setting. So we see a lot of patients with spinal cord injuries, with amputees who have amputations, a lot of other like neurological disorders, and then also just kind of your general orthopedic conditions that someone might go to physical therapy for. Also been involved in doing directing an adaptive sport training program through the university. And we've been working most recently on strength and conditioning with wheelchair basketball team in Pittsburgh. They're called the Steel Wheelers. So we've been working with them on Sundays, and they had us play basketball last weekend, and I got beaten down pretty badly. I was not very good at it, but it was entertaining, at least. And then aside from that too, I've also been involved in doing some research involvement with Pittsburgh as well, with the university. Most recently doing kind of a development of a mobile app that works with patients with spinal cord injuries to be able to do workouts and exercises from what would be something as if it was on your phone that you could kind of follow along with. So that's been really nice too. And then kind of looking to the future, what I've been planning out on doing, I anticipate moving back towards the Cleveland area after graduating. Do not have a job secured yet, but have been starting to kind of look around so far, and just kind of hoping to continue to work in an outpatient neurological setting. So that's kind of where I was, where I'm at, and where I'm going.
Great, well, thank you. That's incredible.
Does anybody
have any questions for Kaitlyn?
Yeah, I do.
Sure.
Kaitlyn, will your job, you say, will be outpatient? Will it be outpatient in a hospital, or will it be a office off the campus of a hospital?
Yeah, so my hope is to be in like an outpatient setting that might be connected with the hospital. I think, as a larger entity, but then, being able to work in an outpatient setting that might be separate from the hospital than actually working in the hospital itself.
Great. Anyone else? Oh, Jeanette?
Yeah, Kaitlyn, in the rehab process, I know that the length of time of rehab would be directly correlated to the injury. But how, sort of as a general rule, how long will you work with like a specific patient? you must develop some really close ties with those people.
Yeah, I feel like you do find that with certain populations of people too, they have much longer visits. Sometimes, often, like you're seeing them 2 to 3 times a week, even for a long duration of time. Um, so it's interesting to kind of see. I would say it varies person to person. Um, some of the people that I've been seeing, I've seen them from May when I started all the way through. I think my longest one, I'm going to try to discharge him when I leave, but that would be kind of the longest duration, and that's a spinal cord injury. And he's been working hard for that length of time too. So I feel like it's hit or miss depending on the person, but a lot of times you get to really develop a relationship with them, like you said.
One other question is, what have you helped this person do?
So when I started working with him, he was using a walker to get around. Before I got there, he was working in even just using a wheelchair. And due to the nature of his injury, he's down to walking with one cane to no canes at all. So pretty significant change in the last few months for him, which is great.
That's great. Congratulations.
So I have a question. Do you have a VA hospital in Cleveland, or do you want to continue to work with veterans?
So there is a VA hospital in Cleveland. I would be interested and open to it, but also not open to, like, not exclusively to working at the VA. I've unfortunately not had like a ton of experience actually working with the VA, but I've heard it's really nice in terms of not having to worry about necessarily insurance limitations that we kind of see a lot with people who aren't through the VA system. But I've heard from great things that even the Cleveland VA has been really, really great. So I've been keeping an eye out on open jobs. So
Well, we wish you luck on that.
thank you.
So
So
what
if
do
you
you
don't-
like?
if you don't
like
mind me jumping
most
in.
about your job or about your career?
Can you say that one more time for me, please?
What do you like most about your career?
Sure. I like, so personally, I think I like best doing that sort of one-on-one interaction with people. I like to facilitate the person allowing to get better, but also kind of encourage them that they have to do it on their own. Like, I'm not going to be the one that makes them better. It's what they put into it as well. And I feel like it's very applicable to a lot of other areas of life too. I like that I can kind of encourage people and help people in like a general sense, but also really encourage them to be the person that makes the change for themselves too.
So what do you like least about your career?
Partially the paperwork, even though it's all online. But then I would say the other thing is just mostly like limitations with insurance companies, especially. A lot of healthcare, I feel like, is just driven by that in nature. So.
All right.
And Kate's got a question.
Oh, sure.
I do have a question. I was hearing you considering a potential career in VA, and I just wanted to put in a little bit of a plug for it because I get 100% of my care at the VA, and any care that they don't have available for me, they can send me out to the community. I'm excited that you're moving to Cleveland because they have one of the top VA hospitals there because of their partnership with Cleveland Clinic.
Mhm.
So if you ended up working there, you would probably see a bunch of folks with white coats with Cleveland Clinic on it, just like we have Michigan Medicine here at Ann Arbor VA.
Yeah.
And there are 2 Fisher houses there. Obviously, that's what I do for work. It's like a Ronald McDonald House at the VA.
Mm-hmm.
And so not only do you get to work with the patients, but the family members are there as advocates and to help with follow-up appointments and to make sure they're doing their PT at home. And it would be a great situation if you ended up in Cleveland. I would be really excited to
That's
see if
awesome.
that's the path that you ended up taking.
Yeah,
End of unsolicited advice.
I love that. Thank you.
Anyone else? Okay, well, thank you, Kaitlyn.